The study argues that safety protocols may delay the spread of the virus, but once they are eased, infection rates start to jump again, suggesting that it may be better to allow younger people to work and attend school while keeping the vulnerable population over 70 years old under lockdown. Well, to talk more on these findings in our TIA Health medical segment, we are joined by Dr. Abhishek Raut, medical director at Appletree Medical Group. Dr. Raut, welcome to the show.
Pleasure to be here.
So let's start by talking about what exactly herd immunity is.
Well, let's imagine you have one infected person of any disease in a specific room. That person may spread that disease to others, and when those people leave the room, they spread it to their families. But imagine now that one infected person is in the room, but the others are actually immune to the disease. If that's the case, no real spread occurs, and then that secondary infection does not occur. That's the idea behind herd immunity. So if we have enough people who have some level of immunity, it prevents the larger population from getting sick.
And has herd immunity ever been reliable in terms of fighting the spread of a disease or virus?
So to put it that way, what we would say is it has been helpful when we're talking about a vaccine. So epidemiologists used herd immunity when comparing vaccinations. Public health officials design programs to bolster herd immunity when there's a vaccination effort. Herd immunity without a vaccine is pretty much unheard of, unfortunately, because it can be quite dangerous to do and expose people needlessly to a virus.
So what are your thoughts on the study findings and its suggestions to lock down only the vulnerable?
So I think there's some good takeaways from it. What they're trying to do is show you that the vulnerable groups are still very vulnerable. So that's very important to consider. What we would want to do is cater our efforts to make sure those who are at higher risk, the elderly, are taking better precautions. And that still is something that the COVID-19 body of evidence is suggesting. So there's certainly some things that are useful in that study there.
And how much herd immunity would we have to develop to stop the spread of COVID-19? And is this realistic?
It's a good question here. Yeah, so I think there have been a few studies talking about that. There's no real consensus, but just let's look at examples. Influenza needs about an 80% vaccination rate for herd immunity. Measles needs approximately 95% vaccination rate. So now we're talking about COVID-19 with no vaccinations here. Likely we're going to look at somewhere between 6 to 80%, let's say 80%. That means 80% of our population would have to be exposed to COVID-19.
So how realistic is that possibility? And what's at risk here, Dr. Raut, if we actually take these steps?
It's a very good question. So is it realistic to expose 80% of the population? So far, even our largest numbers say maybe only 10% are exposed there. But let's say we did manage to have 80% of our population. So we have 37 million people. 80% is about 29.6 million. And keep in mind, when we're talking about exposure, we're talking about deaths as well. 4% do pass away from COVID. That's 1.2 million deaths, which is why when the WHO looks at a study like this, they consider it completely unethical to consider herd immunity without vaccination.
So do you agree with what the head of the WHO is saying, that vaccinations are the key to stopping the pandemic?
I would agree. Vaccine-based herd immunity is really the only way to reach that 80% of Canadians, that way they can build the immunity and stop the infection without exposing themselves to greater risk. This is how we actually eradicated smallpox and polio.
So what would you say are the right moves here in terms of handling these spikes in cases that we're seeing in cities like Toronto and Ottawa? We're seeing lockdown restrictions being reintroduced. Are these good moves?
It's difficult to say. We're still very early on in the disease, but also in the science behind it. I think the most important thing we can do is consider ourselves potential carriers, and then think about those around us who are vulnerable. Think about how we can support those who are vulnerable around us without exposing them to greater risk. And I think we need to just try to be as safe as possible until a vaccine does arrive.
All right, Dr. Raut, always great having you on the show, and we'll see you next week.
Thanks for having me.
Our international segment is coming up after the break, so stay tuned. China gets re-elected to the UN Human Rights Council.